Assalamu alaikum. Dr. Hussain Bashkolachi YouTube channel is now discussing the monsoon fever, a very least discussed public health problem during the summer and rainy season, as the monsoon is hitting India and Pakistan. And when I am recording this video from Karachi, the sky is full with clouds. And today I was traveling from the Hyderabad to Karachi. All the four sides of the sky were full with the monsoon clouds. So monsoon fever is least discussed and reported even in the textbook and in the curriculum, and it is the problem of the subcontinent. So we will discuss more about the monsoon fever. It is just like a symptom of the fever, but it has multiple causes. So the general practitioner, the hospitals, the healthcare providers should be well versed about the monsoon fever. So coming to the next slide, you can see that the top fevers normally diagnosed are the malaria, dengue, and other stomach problems are typhoid, but the scrub typhus fever is very common, and one of the microbiologist from India has mentioned this very well, that it is causing more problem during the monsoon season. So we should take care of this. It is Orantia shushu gamushi, a rickettsia, or a kind of microorganism which leads to this fever, and can cause multi-organ failures as well as ARDS, acute respiratory distress syndrome, which we saw even in the COVID. Then the second least discussed fever cause is leptospirosis. This is also a germ and microorganism and of a special nature. So it is mostly from the rats, dogs, and other animals. If they urinate and contaminate the water, this can be one of the problem. Then we have dengue fever, malaria, and chikungunya. These are very common, and typhoid is also there, and hepatitis also causes fever, and acute respiratory syndromes, which are normally bacterial infection, and cold throat or common cold is important because of the bacterial infection as well as contaminants which the rain brings from the with the water, and if when they are inhaled or they are part of the small droplets of the rain, then it can cause the upper respiratory as well as the nose, running nose or flu-like symptoms. Then mite fever is also there, and another problem is the sulfur which acid rain brings to your body and head. So the scalp hair can also have itching and allergy like conditions. Then coming to the symptoms, you can see that the fever can be up to the 104 or mild, pain and myalgia. Fatigue is important because in viral infection fatigue is more, and then to some extent bleeding from the nose and gums because of the dengue fever, and other symptoms in which leukopenia is there, ARDS, acute respiratory distress syndrome, DIC, disseminated intravascular coagulation, and skin rashes as in the monkeypox. But this is important in scrub fever, which normally our doctors and clinicians are not paying attention to this. Then coming to the lab test, we will have a strong lab test and a rapid lab test also, in which CBC is important, and immunoglobulin test is important, particularly in the leptospirosis and scrub typhus fever. Blood smear for malaria, dengue is important, and rapid test for dengue, malaria, and pox is important. Another area is paraxia of unknown origin. So you will need PCR and other tests so that you can diagnose the hepatitis and other things also. Other diseases which are mbbs, dysentery, diarrhea, cholera. These are stomach and waterborne diseases, vector-borne diseases, and even you can have the low immunity, high humidity, and weather condition and temperature differences. So, particularly if it is a cold, just like today I am in Karachi, rainy season, and cool air is there. So, as the temperature drops, the viral infection they also increase. Then about the prevention, you have to be very careful, and these are the important aspects which are personal hygiene should be kept, hand washing, toothbrushing, washing clean clothes, clean beds and linens, and fomites also. Regular baths is important because you can shed most of the germs from your body heads, and drink safe and plenty water to keep yourself hydrated. And then you have to some exercise, light or heavy, as you can have, or you can have even in the room or on the chair. You can have meditation also, and you can have your own religious obligations. They are also useful for the even yoga, namaz, and other religious practices. They bring a lot of mental peace and health and so on. So no food to be eaten from the streets or open shops. Then keep body warm, and if it is cold, and dry if it is humid. And then is the say some physician, or go to the physician for your symptoms. If fever is there, don't neglect, because it can have scrub fever, it can have leptospirosis, it can have dengue, and it can even be a common cold. If you will neglect, you can land into a more complications. Then thank you very much, and you can see how the monsoon clouds they are there. Dr. Hussain Bashkolaji YouTube channel is always there in forefront. We have discussed the monsoon fever, a new term used for multiple diseases, and even the children, if they are not immunized, please get immunization. Even polio is important, because I was seeing in the superhighway and in the Karachi, lot of polio workers were with their drops and boxes. In Pakistan and in Afghanistan, polio is there, and in rainy season and stagnant water, mosquito breeding, flies, they can cause a lot of nuisance as well as health problems. Then the fungal infections are important, in which the thrush is there, as well as candidiasis is there. They can also cause uneasiness. And even the oral hygiene is important, because a lot of bacteria reside in your mouth, and oral hygiene is important. Those who are disabled people, they should be taken care of. Suppose blind, deaf, dumb, or handicapped with some organ difficulties, old age people, people in isolated places, they should be looked after. I hope I have clarified some aspect of the monsoon as a public health physician or a community medicine and researcher. Thank you for watching and listening this video.